Have you ever wondered, what if your dog suddenly has loose stools? When should you worry about diarrhea? Why does it happen so often in puppies? Can it be caused by something you fed? Is stress really a reason for diarrhea? How dangerous is diarrhea if left untreated? What tests do vets run to find the cause? Can simple home remedies actually work? Which medicines do clinics usually prescribe? And most importantly, how can you protect your dog from this problem? If these questions ever crossed your mind, you are at the right place. Hello everyone, I'm Dr. Jonathan, DVM, and today I'll be explaining everything you need to know about diarrhea in dogs. Why does diarrhea happen? The most common reasons include owner negligence, feeding spoiled food, sudden diet change, or giving table scraps. Unhygienic conditions, dirty bowls, contaminated water, or poor sanitation. Infections, bacterial, E. coli, salmonella, viral, like parvovirus, distemper, or parasites, like worms or Giardia. Other triggers include food allergies, stress, toxins, or underlying organ disease. Inappropriate or sudden changes in your dog's diet, whether it's getting into people food or a change in dog food. Intestinal parasites, like hookworms, tapeworms, Giardia, etc. Bacterial infections, like salmonella, Clostridium overgrowth. Viral infections, like parvovirus, distemper, etc. Stress-related. Now we discuss types of diarrhea in dogs. Here are some common types of dog diarrhea and what they might mean. Small intestinal diarrhea. This type of dog diarrhea is often watery and can be caused by food intolerance, sudden changes in diet, or bacterial overgrowth. Large intestinal diarrhea. This type of dog diarrhea is typically more frequent and may be accompanied by mucus or blood. Causes include inflammatory bowel disease or parasites. Acute diarrhea in dogs. Sometimes dogs may experience a bout of diarrhea that resolves quickly. This is known as acute diarrhea. Your pet will usually recover with a little TLC from you. However, if your dog's diarrhea persists for more than 48 hours, it's time to schedule a vet visit. Chronic diarrhea in dogs. Persistent or recurrent diarrhea in dogs may be more serious and requires veterinary attention. Causes may include hyperthyroidism, dysbiosis, parasites such as worms, exocrine pancreatic insufficiency, cancer, inflammatory bowel disease. Signs and symptoms of gastroenteritis in dogs. Loose, watery, or bloody stools. Vomiting along with diarrhea. Loss of appetite and dehydration. Lethargy or weakness. Fever in some cases. Loss of appetite. Nausea. Drooling secondary to nausea. Vomiting. Watery to soft stool consistency. Voluminous amounts of stool, small bowel, versus small, mucousy, bloody spotting, large bowel. Increased urgency to go outside or increase in the frequency of bowel movements, large bowel. Painful abdomen. Weakness or lethargy. Black or tarry stool. Dehydration. Weight loss with chronic diarrhea. Fever or hypothermia. Diagnosis and lab tests. At a veterinary clinic, we may recommend stool examination to detect parasites or bacteria. Blood tests to check infection or organ function. Imaging, X-ray or ultrasound if a blockage is suspected. Your dog's stool sample to rule out parasitic infections or abnormal bacterial overgrowth. Abdominal X-rays to rule out a foreign body, obstruction, or abnormal fluid in the intestines or abdomen. A complete blood count, or CBC, to evaluate the red and white blood cell count along with the platelet count. A biochemistry panel to evaluate the protein, electrolytes, kidney function, and liver enzymes. A urinalysis to evaluate kidney function. Home and herbal treatments for mild cases. Bland diet, boiled chicken and white rice. Pumpkin puree, plain, not pie filling, natural fiber. Probiotics, restore healthy gut bacteria. Slippery elm bark powder, herbal gut soother, vet approved. Hydration, always keep clean, fresh water available. Offer small, frequent meals to help heal the GI tract. Feed them a low-fat, high-fiber bland diet, such as home-cooked boiled chicken with white rice. My favorite food for diarrhea, since I don't cook, Hill's prescription canned food called W/D for weight diet to help fix the problem fast. Canned pumpkin is also a good source of fiber. Add it to your dog's food to help with diarrhea. For stress-induced diarrhea, start a fiber supplement like psyllium fiber a few days before the stressful event to prevent diarrhea. Veterinary medicines commonly used: metronidazole for bacterial or parasite infections, fenbendazole, also known as Panicur, for worms and Giardia, propectalin or kaolin pectin for anti-diarrheal paste, IV fluids or electrolytes for severe dehydration. Always under vet supervision, never self-medicate without guidance. Preventing diarrhea in dogs. Preventative care is the best way to keep your dog feeling their best. Here are some tips to prevent diarrhea. Keep your dog or cat on monthly heartworm, flea, and tick preventatives to avoid parasites. Don't forget to keep your pet up to date on their vaccinations, which protect against diseases like panleukopenia or viral infections like parvovirus. Please keep your pet away from public places until they complete their full vaccine series. Keep your pet safe from potential hazards like table scraps, bones, and household objects that could pose a risk of poisoning or foreign body ingestion. Gradually introduce the new food over several days to weeks, slowly increasing the amount each day. This will give the gastrointestinal tract time to adjust to the new diet. Observe your pet's reaction to the new diet and adjust as needed. Consult your veterinarian for advice on a safe and healthy dietary change when in doubt.